Hello, everyone. Welcome to this live event from Lean and Equity and Sustainability. And Obi and myself, we decided just to jump on this live to invite you in to this event that is taking place 23rd of May. What time, Obi?
6 p.m. in the UK.
6 p.m. UK,
Yeah.
7 p.m. my time. So 6
Mhm.
p.m. UK. And we're going to drop in on a topic that is very, very important for many women. And also for many women, we are completely unaware of it. So I would love to ask you, Obi, why this topic and why should people attend this event?
Thanks for doing this, Rita. So this topic is around about fibroid, and I don't think um, a lot of people know about it. It affects 1 in 3 women, which is interesting because I didn't think if something affects 1 in 3 women, surely we all should know about it. But apparently, because the symptoms are diverse and it's
Mm,
not always the same, and people react differently to it, and people can go on symptomless without knowing that they've got it, is why it's not as prevalent as we think it is, why we don't talk about it. And so for me, I think it's an important topic. I've experienced it, and I'll talk about that
mm,
in a little bit.
mm.
But it's an important topic because I think if people know what to look out for, they know the symptoms, they know the myths that are associated with some of that, and they understand treatment options, then they're more likely to seek help from their doctors early, and
Yeah,
they probably now know what to ask their
yeah,
GP or to ask for a referral to a gynecologist. That kind of thing. I think that's a great way of getting people round on a conversation that's not talked about as often.
mm,
But
mm,
also, for those people who are not experiencing it,
mm,
being able to spot when a female family member is experiencing it.
mm.
Your sisters, your daughter, right? Your friends, your colleagues, to be
Mm.
able to say, I don't think that doesn't sound normal. Because I think a lot of when it comes to women's period and menstrual cycle, I think there've been so mixed messaging
Mm.
around what is normal and what is not,
Mm.
that I think we just associated our periods to be painful, sometimes heavy, and okay, that's part of life
Yeah.
and nothing to complain or write home about.
Mm.
But actually, that's not the case. So I think the reason I want people to attend this webinar, all women, men, if you want to know what's going on with some of the women, because you might be
Yeah.
realizing that's what this is about.
Yeah.
I think it's for all of us to understand it so that we can educate, but we can just, to me, it's about seeking help much earlier
Mm.
before it does more lasting damages, I think. So
Yeah.
that's my real reason.
Yeah. I think this is really interesting. And also because, in Lean and Equity and Sustainability, we are doing women's health program and we are, bringing more of these issues to the table. And there are many things. And I was so glad to see that we're bringing up something where okay, I'm not glad to say I don't know so much about it, but that we are willing to go into the depth of women's health, where I can say, Obi, you know what? Fibroids, I don't really know that much about it. And when you and I were talking about it, that this event is coming up, and we're going to have Dr. Angela Esiwe with us as well, I was starting to think, who do I know that was
Mm.
in my life really suffering? I mean, really suffering from fibroids. And I remember it was my hairdresser, and she younger than me, and she would kind of say, "I'm so sick today." And I said, "Why aren't you home?" And I realized, and she was sharing with me the pain, the bleeding, the ins and the outs of the hospital, and oh, and then there was a period. Do I remove? Can I have children afterwards? No. And then this making decisions, and I was like, whoa, I have suffered from serious period pains in fetus position 3 days since I was 11 and a half.
Mhm.
And I was like, this is a new dimension. This is an added. awful,
Yeah.
painful dimension. And this woman was standing on her feet and doing her job. And she was, we're running her own business. So we're not going to
Yeah.
go too much into it today because that is happening on the 23rd. And I really
Yeah.
invite everyone to join in there. But I would love to ask you, Obi, when did you realize that something was wrong or off?
Yeah. So it was when was that? So I want to say 2021 January. So remember, we had New Year, Christmas, New Year, all of that stuff. But prior to that, I started doing that. I had period that was bleeding heavier.
Yeah.
I just thought it because I'm in my 40s now,
Yeah.
right? So that was the reason. I just thought, oh, okay, this is what happens when you get older. I thought maybe it's part of the perimenopause situation going on there.
Mm-hmm.
It was heavier, but nothing to write home about. Again, nothing that will make me say I need to go and see my doctor now.
Mm-hmm.
That wasn't it. But by the January, I had a period in January, as you do, monthly period. But then this one started to hurt 2 weeks before the period was due. So I just had this almost like I thought it was ovulating pain, but just more intense. And I'm thinking, I don't really know, this is just weird. Then I took paracetamol, ibuprofen, as you do, and it seemed to dull it.
Yeah.
And then normally you have paracetamol, and 4 hours later it's gone and it's fine, it's done. No, all it did was just dull it, and then the pain just carried on, like it never left. So it's just constant, very dull. Wasn't really as painful, but enough for me to definitely have paracetamol.
Yeah.
But I thought, make it odd. So then I thought I'm going to call the GP. We were still doing video calls at the time, so you would only go and physically see your GP because it's still COVID, and so
Yeah.
you wouldn't only go. They really thought, okay, you need to come in for us to examine you.
Mm.
So I booked a call, and she said, "Oh, probably just his ovulation kind got a bit weird, and maybe an egg did something. I couldn't understand it. Honestly, it's like, okay, fine." She said, "You should be fine when the period starts next week," type of thing. And she was right. Period started. Okay, okay, so that's what that was. End of that. 2 weeks later, it starts again. Almost like in anticipation of the second period. And I'm thinking, this is now February. I'm thinking there's something wrong here. So I call again. And at that point, she said, okay, come in and we'll just examine you.
Yeah.
So I went in, it was a different doctor. And she got on the table, put her hand on my tummy. And then she said, did you know you have fibroid? Like, what?
Yeah. Like, what is that?
Okay. I know I've never been able to have a flat ab. Like, I've never really been able to have a flat, like a waterboard, airtight. I just thought, okay, just my body. Said, no, you've got there's a ball there. There's a fibroid. And so fibroid are non-cancerous growth. That's what they are. They're not cancerous, but they are like tumors that grow in the womb. So this was just getting bigger enough that it now came out of my tummy skin so you could see it and you could feel it. I didn't feel it because I just thought, I got a fat tummy. It's what happens when you get to 40. It's my thought process around that.
Yeah.
And she said, okay, I'm going to go and send you for a scan. So got sent to an ultrasound probably within a month or so. Again, still COVID, so there's still all these little anxiety about going, had to wear the whole mask and everything. So had an ultrasound, and the technician who was there, lovely woman, and she went, oh, and I go, oh, can you see something? And she went, yeah, I see. You got fibroid for sure. I said, oh, how many? And she went, multiples. And I thought, yeah, okay, but what is that multiple, like in how many? Like, well, I was like, yeah, how many? And she said, yeah, about 20 I can see right now. 20. And then the size of it was about size of oranges and little lines, different sizes, but the big one was probably the size of an orange. And then she goes, oh yeah, but you also got endometriomas, so endometriosis, and some cysts. And she said, wow, it's busy in here. Can you imagine that's the first time that I actually knew there was anything going on gynecologically? because as far as I'm concerned, I had normal period, but they weren't normal. I had had heavy period, painful period, but I sucked it up just like a lot of women do.
Yeah.
You just get on with you just down your paracetamol or your ibuprofen,
Yeah.
however you need to have it, almost like Marty's, and then
Yeah.
get on with the work.
Yeah.
You deal with the tummy pain, you do lower back pains I had as well. But again, part of the period, so I didn't see anything out of it. And the only reason that I
Mm.
did go to that GP in January and February was because it was out of the period week. If it was in the period week, I would just assumed it was part of it. It just happened to have come 2 weeks or a week before that
Mm.
made me know this is unusual. Why are you hurting me now?
Yeah.
Of course, going to the toilet, but that wasn't even as bad.
Yeah.
Constipation,
Yeah.
that was another thing I experienced. And again, the constipation was a bit weird because I remember for years
Mm.
I've been unable to go to the toilet during a period.
Yeah.
So for that 5 days, I just wouldn't
Yeah.
go. And when I did try to go, it was just painful. But I just thought, oh, I'll just wait until the period is over. Can you
Yeah.
imagine that? And what was interesting, because I think it's important to know, it's really why I want people to attend this
Mm.
webinar on the 23rd, because I had friends who I would say,
Mm.
hey, because I'm not a you know, I like my privacy and stuff, but I'm one of the people that will share. If I feel
Yeah.
something, I will make sure that I can ask questions about, hey, are you experiencing this? So I was able to talk to a few close friends, and my close friend, I said, "But
Yeah.
do you have trouble going to the toilet during a period?" And
Mhm.
she went, yeah, it happens to me all the time. I just try not to go.
Mm.
And I'm
Mm.
like, oh, okay. So that was my first thing where I thought, this is normal.
Yeah, because somebody else says the same thing instead of thinking, yeah, you might be three people having it
Yeah,
and it's in your friend circle. It doesn't make it normal.
no. Yeah, and she then turned out to have fibroid later on, um, diagnosed before I was,
Mm.
and so it was more like, oh, but I still didn't think that was me because she'd had all these other symptoms and the bleeding and all the things, and in the
Yeah.
way that I kind of had normal bleed. She looked heavy on the side, but nothing again, nothing out of the realms of anything else, and I wasn't swollen. So my stomach was still as flat as you can get it, but it
Yeah.
wasn't anything that you could notice.
Mm.
So of course I get diagnosed with this thing. Then I got extended to go and see to have an MRI taken because there
Mm.
was something they couldn't see on it, or the shadow.
Yeah.
And
Yeah.
once
Yeah.
they see a shadow, they get a little bit panicked. So they
Yeah. It's a
needed
bit
to rule
worried.
out basically cancer. So
Yeah.
that freaked me out. That
Mm.
was scary for the first 2 weeks, 2 weeks turnaround
Mm.
quickly to have this MRI. So I was obviously very scared. And then that's when Dr. Angela Esiwe, she's also a friend of mine. And I was like, I had to call because I didn't know who else I could ask questions
Yeah.
that I didn't want to bother my GP with now because you only get 5 minutes, right? Or 10 minutes.
Mm.
And so I would message and I say, when you get a chance, could you please give me a ring? And Dr. Esiwe would double qualify to see the gynecologist, and then she retrained again at the GP later on in her career. So she got these two access to
Yeah.
expertise that she happened to have. So
Mm.
she was the best person for her to say, yeah, this is normal, that once there's a shadow, you're going to have that looked at. It's unlikely
Mm.
that is cancer, but we need to rule it out. So she did keep me sane and calm. I don't know what I would have done.
Mm.
What do other people do when they don't have family members or friends who are in the medical profession
Mm.
who can support and ask questions on a
Mm.
whim? You see what I mean? A lot of people
Yeah.
don't want to bother their doctors because they feel like,
Mm.
oh, I don't want to feel like I'm exaggerating or
Yeah,
yeah.
and I think actually one of the interesting thing there is as women, this is even with with uh uh with children. Something that I realized is that when a mother says there is something wrong, there is something really wrong.
Mm,
Because we have a tendency to, oh no, it's fine. We're gonna, whatever, it's okay, it's normal. With some part of the family had something and everything's fine. And I think that comes to our health as well, is
hmm
that we're so used to having pains and aches that we think it's normal. It's just normal. And I think that is why this is so important to talk about. Uh, there
Definitely.
are so many things that we are going through, and we're going through it in isolation. We think
Mm,
it's no point. We don't even talk about it amongst our friends, our closest ones, very, very often. Like now I heard you talk about it. I'm just thinking about, the topic of perimenopause, menopause. My goodness, I remember not that long ago, a couple of years ago, it was a group of girlfriends, and there was this one woman who said, I'm not so sure if I want to kind of bring this up. I'm a bit embarrassed, but anyone else has experienced like hot flushes and feeling a bit like off and
Hmm.
brain. And I said, oh my goodness, have you heard about menopause, my darling? Like,
I know that's the
shame,
point, isn't it? And
shame.
because it's not, it's gynecological. We never like talking about our lady bits. That's just like
Yeah,
it's supposed to be a literally a private part. So therefore, the idea that we would talk about what's going on in there
yeah,
it's a stigma we have to get over anyway.
yeah.
But I think that's added to this little secrecy where you're only asking the people that you know or around you. And
Mm,
again, Black women are 3 times more likely to have fibroids. So you can imagine
yeah,
majority of my friends
yeah,
will be from African descent.
yeah,
In that way, I'm Nigerian, so therefore it makes sense that when I ask, oh, every other three people, then oh yeah, so then, like, oh, okay, then. But of course, I don't know that we're 3 times more likely to have it. So I would have spotted that if I knew about it. And I
yeah.
think that's the thing that really I am quite feel strongly on now is the
Mm,
lack of information. Because information, even if you don't need it now, you
mm,
kind of you're going to process information.
mm,
Someone said 3 times Black women 3 times more likely,
mm.
and I'm asking information with other people, have you experienced this?
Yeah,
And 3 out of 5 friends are saying, yeah, I have, but the
yeah,
stats stacks up. That tells me, okay, there's likelihood I might have it to let me go and get checked. But I
yeah,
didn't think to get checked
yeah,
because it was something that was, well, it happened to some people. You see what I
mm,
mean? And then
yeah,
the symptoms were so exaggerated
yeah.
but because I didn't fit that symptom, it was like, oh, okay, it's probably not.
Mm,
Now, it apparently takes 11 years or 13 years for endometriosis to get diagnosed, for example.
mm.
I didn't know that I had that the whole time until this scan, because by all intents and purposes, my symptom didn't fit. And I think that's the reason why I really want
Yeah,
people,
yeah.
because there'll be a lot of people who don't have the severe symptoms like being
Hmm.
described,
Hmm.
where they're like riding in bed and haven't been able to go to work for 5 days.
Yeah,
That wasn't me. So therefore, it made me think, oh, I don't have it, but actually I did.
yeah,
So I
yeah.
think it's really about that for me. And I think in the end, what it resulted in with me having surgery, because I had to have, it was too big,
Mm,
there are too many of them,
mm,
that the course of treatment was the fact that you couldn't have medication. I'll let Dr. Angela describe that on Thursday.
mm.
But you could have medication to reduce to drink it. But mine was too far gone
Yeah,
for that to be an option. So
yeah,
that's what I mean by finding it early.
yeah,
So my only option really was to
yeah,
have surgery, so myomectomy,
yeah.
where I was going to get opened up, go under, general anesthetic,
Mm,
and somebody was going to go in there and start bringing these things
mm,
out
mm.
of me and close me back up, and I'll be in the hospital for 5 days, and that's what it was. I was in the
Mm.
hospital for 5 days because now all of a sudden I can't really move and in pain, and mine was where it was sitting on my tummy that I couldn't even be cut bikini line.
Mm,
So bikini line is where every surgeon want to go, where they
mm,
can.
mm.
But because of where the tumor is, it almost migrate, just over
Yeah, so
here,
it's
that it
complete.
just thought, yeah. And the
It's
surgeon
like,
did say, I wouldn't know what I'm going to cut until I get in there. But he did,
yeah,
that was exactly one of the good information I got from Angela, which is ask where you're going to get cut. Because
yeah,
sometimes you need to know this information
yeah. Just to wake
so that
up
I
and
can
see
make
what's
peace.
coming up.
Exactly.
Yeah.
So he was able to say,
Mm,
I can't tell you that. I don't know until I
yeah,
get there. And once your anesthetic is in, then your body will settle in. Then I'll see where the bolt's coming out.
yeah,
Then I can
yeah,
decide whether I'm going to cut. But it would be minimal and I'll, blah, blah, blah,
yeah.
blah. So he did, but I kind of made peace with, okay, I might have a scar in the middle of my tummy.
Mm. How are you
And so,
feeling now? I'm curious about that. How
mm,
you feel better?
I feel much better in
Mm,
terms of I'm no longer bleeding. I've got tablets I've been put on 3 times a day. I can never pronounce the bloody thing. Um, but 3 times a day I'm taking them to basically halt the period.
mm,
Because I still have the endometriosis and I will probably need surgery for that.
mm,
But the idea was I needed to have 1 year from the previous surgery to have another one.
mm.
But I feel okay. I think I'm still in that situation where I'm trying to work out, is that the best course of action for me to go to another surgery, or do I just take this tablet? The tablet is just muffling it, so it's just making sure that
Yeah, yeah,
but the fibroid is gone. They took out about 22 of them.
Mm.
And that immediate relief in the first few days,
Mm.
really felt that. So I feel much better, much lighter,
Mm.
and all of that. There's something
Yeah.
about it that in your head, because there's something about it disconcerting when you see something
Yeah.
growing in your tummy. It's not a baby.
Mm. And it's
Like,
interesting when you
yeah.
say that. Actually, just coming to mind now, um, I know somebody else she's actually going into surgery next week, and she looks like she's pregnant.
Oh God,
And
yeah.
they didn't know what it was. Like it was like she's just been in all this pain and all these things, and then she just got to realize now is she's got fibroids, and
Yeah.
it's so big that she really looks like she's
Yeah.
pregnant.
I looked six
Mm.
months pregnant.
Yeah.
And so that was weird about buying clothes and hiding this thing. It was something, I think it was more that than
Yeah.
obviously the pain and all of that bleeding and just random bleeding where you have to take tampons and pads everywhere you go and
Mm.
not sure what's going to happen. Well, especially when you're
Mm.
delivering workshop and speaking and all those
Yeah.
things that I was doing in my business, and I was like
Mm.
trying to show up and then realizing that of course your mood is dropping because actually they're not just forget the fiber, but dealing with all the things around it, and
Mm.
deciding I can't wear like what am I going? I kept wearing all these big dresses in tent just to hide the tummy.
Mm.
I remember thinking, well, at least nobody had tried to get off from the tube or on the train for a seat thinking I was pregnant to offer me a seat. That didn't happen. So I figured
Yeah.
maybe it's not too bad. I can be grateful for some things.
Mm.
But yeah, that was very disconcerting. It's like looking at your body in the mirror and thinking something is
Yeah.
growing in it,
Yeah.
or things are growing in it, and it's
Yeah.
not a baby. You know what I mean? There's something
Yeah. It's just
weird
off.
about
Something
that.
is,
It's just
yeah,
off. Yeah.
it's off.
Not a
I'm
nice feeling.
so, yeah, I'm so glad that we're gonna
Mm.
bring this conversation to
Yeah.
the table. And obviously, so as the procedure is with anything that we do in lean inequities, when we're having our meetings, they are closed. It doesn't mean that it's being broadcast all over. So the invitation is for you to really join,
Yeah.
click the link, register, be part of the conversation. You can ask Dr. Angela anything you want. You can ask Obi. We're open. We're talking about it. Anything that you're wondering about, just join us and have this conversation. It's like you're in the safe space of a room of friends and you can ask and talk about anything that you want.
Yeah.
So
Yeah.
any last
Absolutely.
words that you want to
No,
share?
just come, attend. The
Yeah.
reason why it's 6 o'clock UK is that you can be at home, you can be in your kitchen, cooking for the family, whatever, and just have this webinar on in the background if you want to.
Yeah.
You can invite your siblings and sisters and friends to tune in. So send them the link, let them register. 'Cause the idea is more people need to know. That way,
Yeah.
somebody on that call is
Yeah.
going to go, I don't think what's been happening to me is normal. I think I do need to see someone. And if that's all we do that day,
Mm.
I'd be grateful for that. But I think the more of us need to have conversations about this, it affects because it affects fertility. So if you
Mm.
are in that age of where you're looking to have a baby, I can think that I wasn't ever trying for a baby. That's
Mm.
why I didn't catch it. I think the doctors would have caught it if I was, but I wasn't
Yeah.
trying to have a baby.
Yeah.
So I think for a lot of people, if you're that age, you want kids and all that, this is the kind of thing that we need to take
Yeah.
seriously.
Yeah.
So come along,
Yeah.
join in the conversation. Ask Dr. Angela, she's the most, honestly, the loveliest people and the most patient doctor I've ever met, ever.
Beautiful. Beautiful.
Honestly, she is as lovely as I say she sounds. And
Yeah.
she would answer questions and whatever. So whatever questions people have, bring them with you. She would tell you go to your doctor, ask
Yeah.
this and this, because she's not your doctor, so she can't give you advice. But what she would say, go to your doctor and ask for X, Y, and Z, or
Yeah.
blah blah blah. So come,
Yeah.
be part of the discussion,
Yeah.
and leave insightful, knowing that you can save yourself and other people as well from a lifetime of unnecessary pain and
Pain. Yeah.
stuff. Yeah.
Wow. I'm excited.
Me too.
So, yeah. So we'll see you all there. Join. I would probably say don't cook your dinner, get somebody else to cook your dinner when this is going on.
Yeah,
Pay
but you know what I
attention.
mean. I
I
understand.
know.
We know how hard it can be, so we're not judging
Absolutely.
at all. If you need to do that,
Go
just
ahead and
do
do
what you
it.
need to do. Yeah, we'll drop the link to the register. Go and register so we know how many people are coming in, then we know
Yeah,
whether
that's
or not we
good.
want to record or not. Yeah.
Yeah.
Because we don't plan to record because we want people to ask questions. But if we thought we have more people coming, then we might get a second date. But we just need to register so we know what we're expecting.
That is fantastic. Yeah. So
Yeah.
it's not going to be recorded.
No.
It show up, have the opportunity to see Dr. Angela and yourself and the other questions in the room. Sometimes there is so much power in the room because people are asking. So I'll see you there and see the rest of you there.
Thank you. Bye, Rita.
Bye, Obi. Bye. Okay, good. Let me say.